discuss about overactive bladder. Uh, so, in this dreadful situation of COVID, a lot of people with overactive bladder will be finding it difficult to tackle with these things in their house. So, in order to manage this problem, they should understand what is OAB and how to deal with these problems. So, first of all, what is overactive bladder? Overactive bladder is the bladder is highly sensitive. The frequency of urination, that is, the patient needs to void frequently, pass urine at least 7 to 8 times, more than 7 to 8 times in the daytime, and more than 2 times in the night. So, this is the overactive bladder. In overactive bladder, it is very common. At least 1 in 6 adults have overactive bladder, and most commonly they are the age group of 30 to 50 years. So, why there is overactive bladder? What happens? In order to understand this overactive bladder, we will have to understand what is the normal physiology of the bladder. So, the bladder normally it is a storage organ. Once it gets filled up with urine adequately, it sends signal to the brain. The brain immediately asks the blood to contract and relaxes the outflow. Outflow is the urethra. So, the people pass urine once the bladder is full. When this signal gets mixed up, when the bladder contracts, it stimulates the brain, even when it is not full, then they want to pass urine frequently. So, why this happens? Why there is alteration in the signal in case of overactive bladder? This occurs due to several reasons, but most commonly there is no reason found out. So, most of these cases of overactive bladder, there is no specific reason. It just occurs, and over a period of time it disappears by itself. Whereas in some people, in at least 20 to 30% of people, there is underlying neurological problem like Parkinson's disease or a congenital problem by birth defects, or it can be due to a trauma in the spinal cord. Sometimes it can be also due to drugs or diseases like diabetes, renal failure. So in these conditions, overactive bladder can develop. So what is the how to diagnose this overactive bladder? It is quite easy. The doctor who examines will clearly take the symptoms, and then we will ask you to do a urine analysis and a voiding diary. What is voiding diary? Voiding diary is a bladder diary. The urologist asks you to keep a diary which tells us what time, how much amount of urine you pass, and whether there is any urgency or not, or there is any urine leak. So, some people will have urine leak. This type of overactive bladder is known as wet overactive bladder. That is incontinence. So, this voiding diary will give us a clear picture of what is the capacity of bladder and how many times you pass urine, whether it is truly a overactive bladder or it is some other reason like polyuria with the diabetes insipidus, like that. The next investigation we do is a urine analysis, which will tell us whether there is any urinary infection or not, because urinary infection will also cause frequency of urine. Then we commonly do a ultrasound. Ultrasound will show what is the capacity of bladder, whether there are any underlying stones, kidneys are normal, like that will be seen with ultrasound. And the last investigation, which most specific investigation, is cystometry. Cystometry will clearly tell us the degree of overactivity of the bladder, that is the degree of overactivity, and what is the capacity of bladder, and whether there is any abnormality in the contraction of the muscles of the bladder. So, with all these things, we come to the conclusion of the diagnosis. Some people might need a cystoscopy if there is any doubt in the diagnosis. Suppose to rule out a malignancy or some other infection, then cystoscopy might be needed. Regarding the management, the cornerstone in the management of this overactive bladder is a lifestyle modification, which is the most important thing you are going to deal in this time of COVID, because you may not be able to go and meet a consultant urologist at this time. So in the house, you will be finding it difficult to manage. So what you should do at this time of COVID-19, if you have a suspicion of a overactive bladder, the first and foremost thing, you have a lifestyle modification. So, lifestyle modification means you have a dietary restriction. People who are obese are more likely to develop overactive bladder. So, reduce fat intake, reduce weight, avoid constipation. Constipation increases overactive bladder. Regarding water intake, take adequate water intake. Need not reduce water intake, because if you reduce water intake, it will produce concentrated urine infection, which will once again produce increased frequency of urination. And the most important thing is you should avoid caffeinated drinks. Caffeinated drinks such as tea, coffee, or cocoa, and also chocolate you have to avoid. And you have to avoid spicy food, tomato, and citrus fruits. Alcohol is also needs to be avoided, because alcohol produces diuresis. It will produce more urine output. You will have to have more frequency. So these dietary restrictions: reduce weight, avoid constipation, and control your sugar. Diabetes you have to control, because diabetes will produce frequent urine infection. Diabetes also will produce reduced contraction of this bladder. This will increase urinary retention and infection. So all these things you should maintain in your lifestyle modification. We can use pads as and when necessary to avoid soiling, and we can take like these things. So next thing is we can do exercises. So exercises is another cornerstone in management of this overactive bladder, which can be done simply when you are in your house. You can do frequently as and when you want. You can do while watching movies. You can while meeting, while talking. At any time, you can do this exercise, which is known as a Kegel's exercise. Kegel's exercise, what you do is you try to control urine by contracting the muscles. So this you can do regularly, at least 20 to 30 times a day. So this Kegel's exercise will strengthen the muscles and it will control overactive bladder in cases of mild to moderate symptoms. Whereas if you develop more symptoms, then in that condition you will have to meet the urologist for medications. So the common medications which are used in overactive bladder are anticholinergics. These anticholinergics, there are a variety of medicines are available, from selective drugs to non-selective, low dose to high dose. So depending upon your medical conditions and the severity of these problems, the doctor will give the medication. So assessment of the severity will be done by the urologist by a questionnaire. So questionnaire is a OAB questionnaire, which will give us whether the severity is from grade 1 to grade 5. Grade 1 means mild symptoms. Grade 5 is very severe symptoms. So over a period of time, you continue the drugs. Suppose if drugs are not effective, medications are not effective, then in that case, we need to do some surgical interventions like neuromodulation. Neuromodulation is stimulation of the spinal cord. The nerves which go to the bladder are stimulated by a small pacemaker which is kept in the spinal cord. So this will help to control the bladder, and when you stimulate this pacemaker, you can pass urine. That is known as neuromodulation. This is done for severe cases, refractory cases. Another thing is we can do augmentation and botulinum injection. Botulinum injection is given inside the bladder by cystoscopically. It has an effect for 6 to 9 months and needs to be repeated. In very severe cases, need to do a open or a laparoscopic surgery to increase the capacity of bladder, which is known as augmentation. So most of the cases of overactive bladder will settle by themselves. So in most cases, we don't have any underlying neurological causes. They disappear with diet, lifestyle modification, and drugs over a period of time.